Yeah, ask away.
Yeah, sure. Well, I guess I would want to know how much it was going to cost me.
A lot with folks who don't have insurance, and Oregon has pretty good access to, if you're HIV positive, there's pretty good access to care in terms of signing up for health care and health care that pays for medications if you have no income, that sort of thing. So if you have no income or a low income, there's support for getting medications and getting enrolled in health care plans. For everybody I've worked with, that hasn't so far been a barrier.
CareAssist is our state's ADAP, or AIDS Drug Assistance Program. These funds provide the cost of medication, and in Oregon's case, they provide for the cost of medication. They also provide for lab work and doctor's visits for people with HIV. The reason that this is important is because the average cost of medicine for somebody living with HIV is around $12,000 a year. So for somebody who's earning minimum wage, there is no way that they could conceivably pay that cost of medication. So CareAssist is one of the programs that enables people to continue to work, stay healthy, be productive, and pay taxes, be part of their community, and still receive this medication that sustains their life and their health.
I probably want to know if I could hide it from my parents.
Yeah, if you have a preliminary positive test and you're concerned, you don't want your parents to know that and you're on their plan, that's definitely a big concern. I've worked with folks in the past who wanted to wait until they went off their parents' healthcare plan, or maybe didn't want to make an appointment with a healthcare provider until they had thought more about what does it mean? Do I want to tell my parents? Do I not want to tell my parents? So in general, I would encourage someone to take the time they need to do that, while at the same time encouraging them to try to get to a doctor as soon as they can, just so they have as much information as possible about their health care. With most healthcare plans, if you're concerned about the holder of the healthcare plan, like a parent, being notified, they won't necessarily be notified about your healthcare status, but they may get an explanation of benefits that would include something about labs, or if they know how to read those explanation of benefits, it may become clear that something is going on or that you're HIV positive. And so.
Another question I would have is, how many medications am I going to have to take?
I know people who have been HIV positive for years and they've never taken any medication, and it could go that way for a long time. I know people who are HIV positive, they went for a few years without having to take any HIV medicines, and then their viral load went up and their white blood cell count went down, which means that it might be time to start meds, so they started medication. So there are lots of different HIV medicines, and some work better in some people's bodies than others. So sometimes it's one pill a day. Fairly easy. You take it at the same time every day, and people know how to handle that. And sometimes it's a lot of medicine. And this is a little teaching tool that we have. It's a little example of medicines and their instructions that go along with them. So like the way this would work is, these are Skittles, but if they were pills, these would keep you on track. So this says morning, noon, evening, bedtime, and these are the days. So, and these would all come with instructions about if my stomach should be empty, or if it should be full, or if these need to be refrigerated, or there are some different things that go along with that. These might have different side effects that could affect my sleeping, or if I feel nauseated, or headaches, or mood swings. Just like any medication, there could be side effects. So this is sort of an extreme example. This isn't necessarily the norm for young people who test HIV positive, but it's a tool that we've been using for a while, just because back in the day this was very, very common. But now, like I said, depending on your health and how you get HIV and when, what your health is like when it enters your body and how rapidly it affects your immune system, it could be vastly different for two people who got HIV at the same time.
And also, would I be able to have biological children?
So a lot of people with HIV can have biological children is the short answer to that question. And it really is a matter of the parents taking care of their bodies enough so that their viral load goes down. If dad is HIV positive, there are a few things he can do. One is something called sperm washing, which is a medical thing. So he would go to the doctor, he and his partner would both go, he would ejaculate into a cup, they would essentially not bleach the sperm, but they would clear out the HIV and isolate the actual sperm from the semen, and then be able to impregnate his partner that way. And that's a very safe way. It's very expensive, so that's sort of the downfall of sperm washing, but it's an option, and it's a safe option. The other option is having sex and trying it. If he's healthy and his viral load is very, very low, and she's healthy and they don't have any other STDs, they could try and get pregnant. So that's definitely something that people do choose to do. And there is a little bit of risk because semen is going into somebody else's body and it could have HIV in it. If mom is HIV positive and she wants to get pregnant, then the risk is even lower that he would get HIV through sex with her, just because vaginal fluids have less HIV in them than semen. They could become artificially inseminated, same way that anyone else who's trying to get pregnant and needs that option would. So.
I'd also want to know if I could still travel.
People who are HIV positive can do everything. So when we're looking at a person who's HIV positive who wants to move or travel around the world, all of that is totally possible. There are some challenges that other folks don't have sometimes. It depends on how healthy they are, but if they're feeling sick, they might need to stay near their doctor just for right then. I know personally a lot of young people who go to their HIV doctor every 3 months. So they can travel, check in with your doctor before you travel. You can go on your spring break trip during college, or you can, travel Europe for 2 months. You just need to check in and make sure that's okayed by the doctor, and it will depend on your health.
And also, am I going to be able to hook up anymore?
The absolute definitive answer is yes. Yes, you can have sex, you can have fun sex, you can have orgasms.
Okay, so how do you hook up when you're positive? Honey, I love you, to my husband. It's your choice. And it takes 2 or more people to have sex. So if you value the person that you're hooking up with, that you're playing with, and if you value yourself, you're going to find a way to disclose that's comfortable for you. Harm reduction is important. Don't do anything that you don't feel comfortable doing. And at the same time, think about what you're asking someone else to do. So what I do, and this is what works for me, is I disclose. And I use it as part of a conversation about sex. This is what I have. I'm HIV positive. I don't have hepatitis B. I've been vaccinated against it, and I don't have hep C. I'm a Taurus. I like my dog. I make it part of the conversation. Ultimately, what it comes down to is you have to respect yourself enough to trust this and put this information out there.
Just the big thing is communication with your partner and safe sex using condoms, or having the kind of sex where there is no risk and you're not getting fluids on each other, which can be a blast.
And then I guess I'd want to know, can I still party?
Not everyone, but some people, the way that they deal with the stress of finding out they're positive is they act out. You may drink more, you may get high, you may do what you normally do to an excess. And HIV attacks your body's immune system. Alcohol and drugs also put stress on your body's immune system. So if you're getting high more regularly, if you're drinking more, you're causing your body more harm. Because ultimately, these things are going to they're going to rob you of your health. They're going to impact not only your judgment, but maybe some of the decisions that you make as to who you hook up with as well.
Talking to your doctor honestly is always the best thing to do, and being very realistic. Like if you're someone who drinks all the time, you need to tell them that and ask them what is going to be okay for you. If it's not realistic that you'll just stop, then talk to them about it and work it out, and you can still live a healthy and happy life. Just being honest and really in tune with your body and what is healthy for it and what isn't.